everyone. Today is October 7th and it's Trigeminal Neuralgia Awareness Day. So I thought I'd pop on my series on brain surgeries that I've had for trigeminal neuralgia because I haven't posted anything in a long time, and I don't even think I posted last year when I had a balloon rhizotomy surgery on the right side. So for those of you that are coming right directly to this video, let me give you a quick update on what trigeminal neuralgia is. Trigeminal neuralgia is a severe nerve pain disorder that starts from the trigeminal nerve in the brain. It has 3 branches, and the pain executes out like this. It is considered to be one of the most painful disorders of mankind, and there is no cure. The only thing physicians can do presently is offer medications and surgeries, but they are only temporary relief. Sometimes people are lucky enough to get medications that they can stay on that will work for them forever, but that's not generally the case with everyone. I've had 4 procedures. I've had a microvascular decompression on this side. I've had gamma knife radiosurgery, which is radiation to the brain on this side. And I also had a balloon rhizotomy last May. So it's been a year and however many months. So my right side has been the most troublesome, very, very painful. It won't give up. It just won't give up the ghost no matter what. The left side, after the microvascular decompression, it settled down for quite a while and has just recently started to refire those jolting, horrible pains. So oftentimes I'll get it on both sides, like one, then the other, then the other, then the other, all in the same day. I saw my neurosurgeon yesterday. He told me that he goes, I want you to understand how rare it is to have it like that, firing on both sides, and to have compressions on the nerve from vessels or arteries on both sides. It's only 2% of the trigeminal neuralgia people that have trigeminal neuralgia have that. So it's usually just one side that it affects. If you want to go and watch those other videos that explain the microvascular decompression, I'll put a card here or wherever it goes, and I'll just direct you directly to those videos. So today I'm just going to talk a little bit about first Trigeminal Awareness Day. On this day, we cover social media in teal. I'm wearing my shirt, my teal earrings, my headband. I usually have on teal nail polish. I'm going to be putting some teal lanterns in my window, and I'll put a little card on how to make those. And what we're trying to do is bring awareness to trigeminal neuralgia, because awareness then prompts a cure. And it's really amazing as the years have gone by. Like today, I got a text from my niece, and she goes, I just wanted you to know that, I don't know if I say happy Trigeminal Neuralgia Day, but that I'm thinking of you. And, I just want you to know that you're in my thoughts. And that would have never happened like 8 years ago. It's just because people are just flooding social media with awareness about this, and that is fantastic. There are races that are run. If you'll notice in your cities, most big cities downtown will be lit up in teal. The bridges, sides of buildings, you wonder, how come that bridge is in teal? That's why. So now I want to talk a little bit about my most recent surgery, the balloon rhizotomy, for anyone that may have to have that. So what it does, the gamma knife surgery is radiation with the hopes that they can destroy the back of the nerve And with the balloon rhizotomy, the most simple way of thinking of it is they're going in from another angle and hopefully trying to destroy the front of the nerve. If that's the simplest way I can describe it. They don't want to destroy it completely. They don't want you to become too numb because that can lead to another condition called anesthesia dolorosa, which is very, very painful and permanent. And then there's nothing they can do. So, what they did for me is you go in the hospital. It was during COVID, so you have to have brain surgery with nobody with you. Ugh. And so you're put under general anesthetic. Then the doctor inserts a needle or cannula and it goes in kind of in the side of your cheek, goes all the way down to the base of the brain here, and then through that cannula he inserts a teeny balloon, and when they get to the right correct place on the nerve, they inflate the balloon for a specific period of time, and it's not very long, like 6 seconds, or I'm not sure exactly the time, but not very long, because if they do it too long, that's where the damage comes in. Then they pull the balloon out and they pull the cannula out. So basically, it's pretty simple brain surgery, although they are touching things, and there's always the risks of everything, all these different things with surgery and general anesthetic, and particularly with brain surgery, there's always a risk of they could hit something and cause a stroke. It's a very minor risk, but it's a risk. So you have to think of these things when you're having all of these procedures. So for me, when I woke up, I was in the most excruciating pain. Would have never thought that because of all the things they did. Well, gamma knife, well, no, it was more invasive. Of all the things they've done to my brain, this was by far, the most painful of all. The neurosurgeon explained that when he stuck the cannula in and then stuck the balloon in, he had trouble finding where to put it. It has to be on the exact spot on the nerve, and he couldn't find it. He said it was starting to swell. So it took what should have taken probably 10-15 minutes, took an hour and a half. So the whole meaty part of my cheek is where I was feeling all that pain because, he was doing this throughout, trying to get it in the right place. That's why it hurt so bad. So, having said that, most people that have that done do not have that kind of post-operative pain. Oh, it was awful. And to make matters worse, I went back to the emergency because I'm thinking it shouldn't hurt this much. Nobody can go in with me to the emergency. I'm in so much pain. I had taken painkillers, so you're not as coherent, and you can't be an advocate for yourself because you're kind of dopey and you're in a lot of pain and you're 1 day post-op. So I go into the hospital, the ER, they put me in a room, they give me more painkillers, so knock me out. And I remember waking up and saying to the nurse, "Oh my God, I have never been in this much pain." And she turns her back to me and says, "Well, after so many brain surgeries, you should be used to it by now." And I'm like, what a horrible, horrible thing to say. Horrible. So this whole experience for me, I hated it. I know it was a one-off. I reported the nurse. Having said that, though, that is not going to be everyone's experience. So I don't want you to be scared off by that, but that was my personal experience. As far as it relieving the trigeminal pain, my mouth was numb. It still is numb. He asked me that yesterday. It's still numb. And he said that is one of the dangers. He probably won't ever do it again on this side because it's still numb, like dentist numb from here like just this patch here. So if I was to really pinch my face, you can see, oh, I'm pinching, I can't feel that. So if I talk too much, if I'm having a bad day, if it's hard to chew, and it's interesting, the hard to chew, it's not that it's hard to chew, your mouth gets tired, the muscles get really tired. That's getting so much better, but it is hard to chew. My face just goes numb, even more probably this whole thing. But as far as relieving the trigeminal pain, as I said, this right side has been relentless, and it was the hardest of both sides, and it did relieve it somewhat. For a few months it did. Right now I'm in a really bad flare. They're going to refer me back to the pain clinic and try to get some really good pain management going on first. I have some other problems with my jaw. I've got TMJ, and that's triggering the trigeminal neuralgia pain too. So it's not just trigeminal neuralgia for some people. If you've had a spinal fusion or any neck surgery, that'll trigger your trigeminal neuralgia. So, like he said, I just don't want to go in there and keep operating and operating and operating. If it isn't working, I could do more damage, and we don't want to do that. So we're just going to try and get some kind of really good pain management. So I'm going to go now. I just wanted to say, not happy. I just wanted to make you aware that it's Trigeminal Neuralgia Awareness Day, October 7th. And all of October is Facial Pain Awareness Month. So if you don't know anything about facial pain or trigeminal neuralgia, take some time to Google it, just so that you know. One of your friends or family members may keep complaining that they have this excruciating pain in their face. It feels like they have the worst toothache ever. And it could be trigeminal pain. And it's something worth mentioning to their family doctor. So thanks so much for watching. And hopefully you won't see me with another surgery update. But I will be back soon with more news on trigeminal neuralgia. Bye.